Welcome to Business Connection. I'm Liz Spencer. We have a fascinating guest in studio today. It's Dr. Justin Koop from Inspired Health Center. Welcome, Dr. Koop.
Thank you. Great to be here.
I say fascinating because you're talking to me about functional medicine, and I think that's something very old but very new. So tell me a little bit about it.
Yes, and I agree. It is kind of more of a traditional approach to healthcare, but in many ways in our current kind of setting, it's more of a unique approach to healthcare. And the biggest thing is functional medicine as a whole is a whole body, personalized approach to healthcare that's focus is to get to the root cause, get to the real underlying reason why there's a problem.
And today, I think we spend a lot of time seeing specialists, but we don't take a look at the whole body, as you said, and we've gotten away from that. So that's, I think, fascinating. How did you get into this? Why did you start embracing functional medicine?
Well, I became a doctor first and foremost because I really had a passion to get out there and help people and change their lives. That's really what I wanted to do. I got into chiropractic care originally, so my doctorate is in chiropractic because I wanted to get to that underlying reason of things and have a more holistic approach. And I had that type of practice for many years. But literally, me and my wife decided to completely change our lives as well as our entire practice based on a personal health crisis that we had gone through. So a few years back, my wife had gone through her own health crisis like many people have gone through with various things. And we were trying to live a very healthy lifestyle. We were focusing on nutrition and exercise and trying to decrease stress levels and a lot of these things that we hear that we need to be doing, and we were practicing that. But we still got into a crisis, so I want to share a little bit about that story.
Sure.
We have 3 children, so just after our 3rd child was born, he was literally still an infant, newborn. My wife had gone back into her profession, well, she's a tax accountant, so she went right into tax season. So stress levels were a little high.
A little high there, yeah.
Yep.
Yeah, it's a tough job.
And she started dealing with some issues. She was having some digestive problems and some significant pain issues. And at first, it kind of started off a little bit more sporadic, and then they got a little bit more intense. And it literally hit her Easter morning. We were at visiting family, and she couldn't get out of bed. She was in just horrible, horrible pain. And we knew, because we had seen this before, she had a family history of things like gallstones and gallbladder issues. And she had all the signs and symptoms of that. So after this major event, we're like, okay, let's do some testing. And we went and the traditional approach and had the ultrasounds and everything. And yes, it was gallstones. But personally, we had seen her mom had gallbladder surgery 30 years before that and had almost the exact same symptoms, the horrible pain, the digestive stuff, had the surgery, was hopeful that would fix everything, and what she discovered was it didn't. So she still had digestive problems and all these things, and that continued for decades and decades. Her younger sister, my wife's younger sister, who was only 26 at the time, also dealt with these same issues, had surgery, had it removed, and also discovered that things needed to be different. So when my wife found this out, we were like, okay, we knew the traditional approach, surgery, didn't necessarily get to the underlying cause. My wife herself didn't want to do that. She wanted to figure out what the reason was. Mm-hmm. But the struggle was there was another option. We weren't given that option. So literally we had to find what to do and search it out. And she was literally living on green smoothies for months until we could find it. But we found a functional doctor who helped us get to the underlying cause, which, as we discovered, was years and years and years of just having digestive problems that weren't being addressed because she wasn't having any signs or symptoms of it. Right. So he helped us get to the underlying cause, and that experience, the whole process was kind of, it was frustrating to us. Mm-hmm. We thought we were doing what we needed to be doing, and she still had this major issue, and then we didn't know what to do to help it. That changed our lives. So that experience changed us personally as a family, but changed me as a doctor as far as I wanted to get out there and do more of this functional-based medicine because I saw that it was missing. This is what we needed to do to really transform healthcare. So that's what got me into it, and it's been amazing.
That's awesome. Well, and oftentimes it is that personal struggle that leads us to that aha moment. Yeah. And that is very true with you, I think.
Absolutely.
So you talked about, and lots of us have digestive disorders. I know many folks, so it makes me think, I wonder what's going on. But tell me about the types of patients who want to seek you out, who are looking for that functional medicine.
Yeah, and to be honest, the person that benefits from functional medicine is anyone who's looking for better health and better health outcomes. But the person that's really kind of searching for what we do is a person who's kind of, they're dealing with some issue, whether it's digestive or if it's an autoimmune or a thyroid issue, but they've kind of been bouncing around from doctor to doctor or specialist to specialist, and they're getting treatments, they're getting therapies, but they're not really feeling like things are changing. They're not getting to that resolution that they're really looking for. And most of the time they're getting kind of frustrated because things aren't really improving, and they're dealing with things like weight gain and energy issues and sleep issues, and they're just not feeling that they're getting better. That's a person that we really help transform, because our focus isn't just naming what they have going on, but it's figuring out why is it going on and get into that deeper reason of why, so then we can actually start turning things around for them.
And I think that why is going to lead me into my next question about how do you form that program around that why? What is your program like when I come see you?
So when we deal with functional medicine, we use a lot of things that we're familiar with. So it starts with getting a very detailed history from a patient and asking certain questions. Sometimes these questions haven't been asked, but answering those. Using conventional diagnostic tools like blood work and other types of tests, but also using functional markers. So we're looking at the labs in a little bit different set of eyes and a little bit different viewpoint, because we really want to kind of get what's the full picture here. What really is kind of the full picture of what this person is dealing with. So then we can actually start getting into that why. So that first is gathering that information. And then once we kind of gather that information, then we structure an approach to start changing that. And so, yeah, a lot of times it works with things like digestion and nutrition. And our focus in our practice is what we call the 5 pillars of health. And these pillars are basically what support our health. So we have a lifestyle program that's dedicated to helping educate and teach a person into how do we support these pillars. The first pillar is nutrition, making sure that we're eating the right things and we're not eating the things that are not good for our bodies, and that's a very unique thing for some people. Cleansing the body, so really kind of helping the digestive system, helping your liver, helping everything kind of cleanse and detoxify, getting some of the toxins out of our body. Hormones, so looking at hormones and looking to see what has kind of shifted and how do we get those hormones back. And a lot of times things like hormone imbalances go back to things like toxicities and digestive problems. So again, we kind of have to look at all these things as how they relate to one another. Fitness and exercise. So we got to learn how to exercise in a way that's realistic and that's doable for people. I meet a lot of people who, I ask them if they exercise, and they're like, yeah, I'm walking. And I'm like, that's great. But that's not exercise. That's living, which is awesome. But we need to do something a little bit more than that. And it doesn't have to be hard, but we just have to have a better approach to that. And then the 5th pillar is our nervous system, making sure that your brain is working well and it's not under stress and it's not, and then it's actually communicating to the body that there's nothing interfering with that. So our focus is taking those 5 pillars and looking at what's going on here, how are they relating to each other, and how do we start building those to put them back in place.
Is this something that you talk about at your dinners that you offer people and come join us for dinner?
Yes.
I think that's really nice.
Yeah, well, to me, it's like, let's come down, let's have a meal, let's sit down and really talk about what we can do to change our lives and change our health. And so our presentations we do, they're free because we want people to come and learn there's other options. There's other ways that we can really take care of our health and be in charge of our health and transform our health. And a lot of times people haven't heard this option. So yeah, we do these presentations. We usually do a couple a month, and they're on our website. So you can go to our website and get the dates that are coming up. And we try to do them all around the Naperville area, Naperville, Aurora area here. And it's a fun experience, and people can kind of learn other options to take care of their own health.
Well, thank you so much for stopping by. It's been very educational. I loved it. I wish you a lot of luck, and I think you're onto something here. So thank you so much.
Thank you very much.
We're going to be right back with more Business Connection. Stay tuned.